Transcatheter aortic valve replacement. In this video, we are detailedly discussing about the TAVR or transcatheter aortic valve replacement. So, in that name only, aortic valve is that. So, aortic valve is that oxygenated blood through the aortic valve only, or our body from the heart we are getting that oxygenated blood from the left ventricle. So in that CT scan, what will be coming, the aortic valve opening portion from the heart, when that blood will coming now, that portion will be blockaging because of the some obstruction. So in this case, what will the procedure TAVR? So one tube like structure they are inserting through the vein and to the aortic valve. So in that tube like structure, what will be happen, that balloon expanding, that blockaging part only we are expanding that balloon. So what will be happen after expanding the balloon, that blockaging part again that opening normal position, that blockaging part only we are expanding that balloon. So what will be happen, the blockaging part again opening, that again normal blood flow can be occur. So you can see in the picture. So before it is the fully blockaging, after inserting the balloon, that opening part will be opening part will be happen. Because of that, the again normal blood flow can be occur. So this is the procedure is called TAVR or transcatheter aortic valve replacement. I hope this video helpful for you. Thanks for watching this video. Please like and subscribe my channel Nursing King for like this information.